this is a contractor that does not interface with veterans. We're going to keep that in the VA. What the Community Care Network does is they go out and they find providers for us. So if I say in Bend I need another cardiologist, they go out and they find a cardiologist that will contract with us, and they sign them up and they check their credentials and they pay the bills. That's another part of the Mission Act, is we're modernizing our IT systems. If you can believe it or not, prior to the Mission Act, doctors had to submit all their bills on paper. Nobody else in the world does that. Everyone has gone to electronic claims submission, processing, and payment. And we are moving in that direction too. I do want to talk about some issues that we've had with the Mission Act. It has not been perfect. So a lot of veterans think that because we have the Mission Act, that all of the services they need are going to be within their communities. So I've had veterans contact me saying, you know, I live in Tillamook and I need a substance use disorder treatment program, and there's not one there that we can refer people to. I can't make people open practices in communities. So a lot of the rural communities are still having to drive to a larger city or town to find services. Veterans are often frustrated when they choose to go to the community and the community can't get them in within 90 days or within 30 days, which is the goal for specialty care. And this comes up with a lot of things that are pretty serious. If you are newly diagnosed with a cardiac issue and you need to see a cardiologist, in the VA I can get you in about 35 days. In the community for a new cardiology appointment in many markets, it's closer to 90 days. Just because the community is pretty saturated. Urgent care access. Not all of our markets have an urgent care facility for us to contract with. And when our contractor went out and found some, they went to some providers' offices who say, yes, we'll sign up for urgent care, but urgent care is only for patients that are seen in that clinic for primary care. We think we've cleaned up all of that. We are working really hard with our contractor to get more facilities, urgent care facilities in. Right now we have 19 that are on the list that Tri-West is working on for us. One of them is Tillamook. I know that's been challenging for a lot of people because we don't have, there's only one urgent care facility in Tillamook, and we are in conversation with them right now to get them signed up. It looks promising. On the 19 we're working with, it includes Tillamook, Seaside, Bend, and Redmond, which are some of the areas where we haven't had a lot of resources. And every day where I identify markets that don't have urgent care access and there's an urgent care clinic in that community, we're getting that information to Tri-West so that they can go out and try to get them contracted for us.